everybody. Thanks for joining us at our annual virtual face event. My name is Shelley.
I'm Ashley.
And I'm Andrea.
And we're going to be talking to you about our maintenance plans, our medical grade skincare, and our chemical peels. So I'm going to start and talk to you about our maintenance plans. So what that means is we're going to help get you set up with how to make a plan for about a year long. And it's very important to maintain your skincare treatments. You don't want to just start with these wonderful treatments, transform your skin, and then just let it go. So it's really important also to think about layering and targeting each layer of the skin. So we have these little printouts, and after we see you for your evaluation and assess your concerns and your skincare needs, then we can really map this out for you, and it'll really make it a lot easier. You'll know when you need to come in for what. It'll be a lot less overwhelming. So part of this though starts with our skincare. And so Ashley's going to chat with you about that.
All right, so we offer medical grade skincare here in our office. We have Epionce, which is our botanical line. Zeo is more transformative, a little bit more aggressive, more active ingredients. Neocutis is going to be our human growth factor line. Teoxane is a Swiss company, and they make their products with resilient hyaluronic acid to help lock in moisture. And then SkinCeuticals is our antioxidant line, and they make a great post-care treatment mask that we actually use in office after your treatments. So the importance of medical grade skincare, lots of patients ask us what's the difference between medical grade versus drugstore. Medical grade skincare has more robust studies. They have better and higher quality ingredients, and then they're actually packaged a little bit more delicately, so these ingredients that they have put in don't inactivate. So your skincare at home is going to be your daily brushing and flossing, but coming in to see us for treatments is going to be your deep cleaning, just like at the dentist. And if you are going to do anything, start with medical grade treatments, and if you're kind of unsure about where to start with treatments in office, you're going to probably want to start with chemical peels. It's a really good segue into treatments.
So we offer 4 different types of chemical peels here. Starting out, our most light peel is going to be our Epionce lunchtime peel. There's essentially little to no downtime with that. It's just a really nice, essentially deeper exfoliator. From that, you would go up to our Vitalize peel. That does have our AHAs and BHAs in it, so it's a little bit more strong. So if you are using a retinol at home, you would be okay to start there, but if not, I would definitely start with the Epionce and work you up to the Vitalize. From the Vitalize, you would then go up to our Rejuvenize. That's about our strongest peel. Expect about 5 to 7 days of downtime with that of peeling, and then from there, we also have our VI peel, which is great for people that have severe hyperpigmentation and melasma. Also expect about 5 to 7 days with downtime there. These are great for all skin types, all ages, really great starting point, and then from here we can kind of integrate you into a little more invasive treatments. We really look forward to working with you guys. We'd love for you to come in for a consultation so we can sit down and talk more in depth with you about all of these things and set you up for a maintenance plan for the next year. Now back to you, Dr. Burgess.